If you know that you've got arthritis in your neck, but you're worried then about having anybody do work on your neck because you're concerned it's going to stir it up, this video here is going to be for you. Hi, my name is Dr. Jeffrey Hanna, and I'm an upper cervical chiropractor here at Clear Chiropractic. And this is a very common question and a very important concern for people who have been experiencing or have a long history of neck pain, headaches, migraines, balance issues, dizziness issues, whatever combinations of things that it is, and you know that you've got arthritis in your neck. You're worried that stretching, popping, twisting, cracking, it's just going to simply make things worse. And what I want to assure you is that that is not the way that this particular brand of chiropractic works. So what I'm going to do is I'm actually going to take a little step backwards and just sort of explain just a wee little bit about the nature of arthritis, because a lot of times people think it's a consequence of getting older, and that, simply put, is not true. That is a myth. Arthritis, and it does come in a lot of different flavors, but in particular we're referring to osteoarthritis. This is where you have a normal joint which is designed to be moving a certain way. Okay? But you've had an injury at some point in the past that has affected the normal alignment and the normal motion of that joint. And as a consequence, your body is laying down additional bits of calcium, that is, additional bits of bone, in order to provide more stability through that particular area. Now, the consequence of that is it means that things may not be moving necessarily exactly the same as they would have been when you were a lot younger. So depending whether the injury so happened to affect your neck, your shoulder, your hips, your lower back, it can happen in any joint, any part of your body. But it's a telltale sign that you actually had a physical injury that was never properly resolved. Why? Because we know to think about broken bones, we know to think about dislocations, but the little boo-boos, the minor car accidents, the slips, the falls, the sports accidents, the fender benders, all of these micro things that we didn't think caused any damage, guess what? They probably did. It just didn't cause the kind that prompted you to go to the emergency room or to seek the right kind of care at the time when you actually needed it. And as a consequence, your body has effectively laid down rust. Think of osteoarthritis like that. It's the accumulation of rust over a period of time. And the amount of rust is directly proportional to the length of the injury. So pay attention here. Just because you may be getting chronologically older does not guarantee that you're going to have arthritis. I mean, do think about this. We have people all the time. They say, oh, I needed a hip replacement surgery for my left hip because they're with arthritis. Well, if it was just chronological age, what? Is your left hip older than your right hip? Or if it's neck and you know that you have arthritis in your neck, and the most common area it's going to be affected is about the area of the C5 and the C6. Okay, well, are those particular vertebrae any older than any of the others in the entire rest of your spine? The answer is no. So what's happened is that you've had an injury and it's been affecting one place more than others, and so it has been biologically aging faster. Now, of course, as we do get older, it's more likely that we've experienced physical injuries, problems, ailments, and all that sort of stuff. That's why we see arthritis more commonly in older people. But even in 20-year-olds and even in teens these days, either because it used to be, birth traumas or slips and falls when people were learning to walk or ride bicycles and whatnot, but now we have devices, computers, phones, all that sort of stuff where we're constantly looking down. And that is putting repetitive stress and strain through our joints. And unfortunately, even kids in their 20s, we're seeing arthritic changes that we didn't used to see in people till they were turning about 40. So, again, not simply a matter of age. It's a matter of something's actually going on, and the truth is it probably needed to be corrected a long time ago. Now, what if you already have arthritis? Does that mean that it's too late? The short answer is no. Because you see, even if those joints are not moving as well as they should be, ideally, the last thing that you want to do is not have them moving at all. The worst thing that you can do with arthritis, even if it is causing you pain, irritation, all that sort of stuff, is to stop moving it. Why? Because then that rust is going to completely seize up, and then guess what? Then it's never going to move again. And if it doesn't move again, that's going to cause a whole bunch of other pain and discomfort. So very important, the number one most important thing that a person can do if they do have arthritis, move your body to the best of your ability. Now, it doesn't have to be hard, strenuous, aggravating kind of exercise, no, but the act of moving and doing the very best that you can. Now, in that same regard, then, the question is, well, should I see a chiropractor if I know that I have arthritis? The short answer is yes. Why? Because that is the entire profession that is focused on being able to help to make sure that those individual joints are moving the way that they are supposed to. However, and this is the big but right here, buyer beware. And it's because not all different forms of chiropractic are appropriate for all people. So if you're watching this video and you've never been to see a chiropractor, you've been to the kind in the variety where there's a twist or a crack or a pop, you probably don't know that there are actually 40 different mainstream chiropractic methods that are out there. And the vast majority do not actually involve the twisty, stretchy, poppy, cracky kind. Because guess what? Especially if you you do have a significant degree of degenerative arthritis, that is not going to be a good idea for you. So your concerns are absolutely founded. So instead, what's important, and this is actually, what I advocate to do for everybody, because everybody is different architecturally on the outside, and guess what? Also on the inside. We look different from person to person, but also the inside, the way that our joints fit together is different. I use this, if you would, as kind of a bit of a silly example, but it illustrates the point pretty well, pretty clearly here, right? So you would recognize both of these devices as keys, right? But guess what? This key will not fit in this lock. It will not work. Yes, you can try to bash it with more force, and if you hit a door with enough force, yeah, you're going to be able to open it, no problem. But wouldn't it be nicer if you actually had a custom fit key that's able to unlock that door with the least amount of force possible? So where am I getting at is with people when they've got a large amount of degenerative arthritis, that is the kind of correction that you actually need. You don't want to bash the door down. You want to have a detailed look and approach that, okay, even when you've got these degenerative changes, you can still identify this is what the individual shape of your joints is, including in your neck. This is the way that we can move things. This is the way that we should not move things. And so what we do then is we are actually doing a series of diagnostic tests, but then also tailoring the adjustment for you, your unique genetics, your unique anatomy, and your unique circumstances, including the way that those joints may have remodeled themselves over a period of time, so that we can help get them moving in the right way with the least amount of force possible, so that your body then is able to do the work on its own. And what that means is that we don't have to twist, crack, pop, or do anything like that. I personally have seen people very much well into their 90s. I have also seen people whose neck is in their 40s and 50s absolutely riddled with arthritis. And I can see that they can still get an awful lot better. Now, does that mean that the adjustment takes the arthritis away? No, it doesn't. And just because you may have arthritis, that's actually not a guarantee that you're supposed to experience pain, stiffness, discomfort for the entire rest of your life. That simply is not true. You see, people walk around with arthritis all the time. It's about when that arthritis is irritated. That's what the issue is. So anything that you can do that's going to minimize that amount of stress on your structure, even when there is damage, to help things move as good as possible in the safest, and most appropriate way possible. It all goes towards helping improve your quality of living. Now, one little thing, because as your body does start to make changes even after an adjustment, I'd like to tell you, okay, whoa, I don't have, any problems whatsoever. No. There can actually be a bit of a shift and a shuffle. But what we're always looking for is a good trade. So if you have and experience arthritic pain, you know that deep, sharp, burning, aching kind of sensation. The nasty bit where it's like, I just don't want to move this because it hurts so much. Now, if you can take the pressure out of the joint, which is a ligament, then what it's characteristically going to do is it's going to move into other parts of your body, and the muscle is going to start to do the work. And what does muscle feel like when it's been activated for the first time in a really long time? It's like going to the gym. You're going to be sore. It can be a deep ache. But my point here is as much as I'd like to say, yes, we make an adjustment, all your pain goes away, that's not true. So what we're looking for is a good trade. We're looking for where that deep gnawing aching is going to be going away, even if you're then getting the achiness, the soreness that's associated with muscle. Because in the muscle, that is where your body is properly able to compensate for that stress. So yes, you're still experiencing a certain degree of discomfort, but in one circumstance, it is most debilitating to do any degree of movement. And the other one, yeah, it's still aching, but you're able to function and do the things that you want as a human being. That's what we're looking at. And that's the way that this particular approach, by being very precise and giving customized correction for you, is able to help people out, even if you do have a significant amount of arthritis. So I do hope that you have enjoyed this particular video. If you have, please do like and subscribe to the channel, and share this with your friends and family. Why? Because it helps the YouTube algorithm recognize that this is useful, and so that this information can get out to helping other people. And if we've said something in this video that you're like, okay, wow, that sounds like me, I'd like to get some help out, we'd encourage you, go over to our website, Clear Chiro Spokane, or give us a call to schedule an appointment in the office. We would be happy to have a chat with you, find out what you can do to help. My name is Dr. Jeffrey Hanna at Clear Chiropractic in Spokane. Get well, live well, stay well. Take care. Bye-bye now.